What we've built here is really a home that nurtures health and well-being overall. The way it's designed does not feel like a healthcare facility. I'd love to say we're walking into almost like a four-star hotel. Cooper Green was established originally to ensure those individuals within the county had access to healthcare that perhaps had limited options before. Its mission really is to deliver the highest quality care to the vulnerable populations in which we serve.
We had an old quilt that was in the old building in our lobby that was donated to us on the 100th anniversary of indigent care in the county. The Gresham Smith team took that and they worked out the design based around that same idea of continuing indigent care.
Cooper Green embodies the sense of a thriving community, so in that way this was a very natural guide for our own design. The quilt provided a very unique inspiration for the entire design. Start with the concept of the patchwork, in which each piece is individual and unique but comes together for the creation of a greater good. Staff are very valuable throughout this entire process. Naturally, we would always create outdoor spaces, but the staff and leadership really wanted to emphasize the use of these spaces, not only for patients, but staff as well. So we have walking trails, we have outdoor terrace, we have staff break areas. All of these enhance the sense of community. The patients, the staff have so much pride in their building, in their community. We wanted to continue that spirit in this design and give them something to be proud of.
One thing that we talked to Cooper Green about early on is how can we make it more likely that the community would want to engage with this building. So deinstitutionalizing the interior was a big part of that. You see the scale of the building and the different scales that we've implemented throughout are very intimate, not to become too overwhelming and to really feel more like you are visiting somebody's home. You'll see through a lot of the design elements that those waiting rooms are the living room of the building. We pulled a lot of motifs and aesthetic elements from residential design to incorporate those, create a sense of familiarity for patients that are coming to spend time there. As a part of our process, the interior design team really took a personal approach to our art package and even to the quilt that we created in the lobby.
The passion about this quilt and the love for it was something that inspired us so immediately during the design process. The design team really took a holistic view of thinking of how can we apply this concept to the building design. From before you even step foot in the building, you are starting that experience, and then as you move throughout the space, all the way from the front door into your patient room, you can see the depth of this concept and this motif in all aspects of the building design and the materiality selected. As we designed the lobby and developed it, we knew that we wanted to design our own modernized version of this quilt in the facility that incorporated all of Jefferson County, its staff, and the patients in the facility.
We didn't want to start with kind of the typical approach to artwork and healthcare facility. We wanted it to be directly reflective of the community that Cooper Green serves. There were over 300 pieces of art that we handpicked. A lot of that included talking to local artists, going to their studios, seeing their process. We wanted everything to tell a story. We wanted it to support our story of people and relationships through that fabric of a community. So every piece had a purpose. We care so much about what we can bring to our healthcare design, and artwork really is a way to physically illustrate that personalization and the care and the time that goes into making it an experience.
When a patient makes all the effort to get here, we can take care of almost all their needs. We've been able to, for example, open an eyeglass shop here. We weren't able to have that there, the space didn't allow for it. One of our patients came in to get their glasses and put on their glasses, and she was in tears because she's always needed glasses, but she's never been able to afford glasses. Gresham Smith really took this to the next level, took it beyond what you would think for a regular healthcare facility. I think the way they did that was listening. You know, that's 80% of your healthcare is those social determinants of health, where you live and work and play, and just 20% is taking care of that encounter with the doctor. So if we're really trying to keep people healthy, we need all that to come together. And I think they heard that.
I was personally floored with what we ended up with. I think Cooper Green is the nicest healthcare facility, certainly in Birmingham, maybe within the state. Most importantly, we've created a facility that truly demonstrates the respect and the dignity that our patients deserve. I think it came together very nicely with what we were hoping for. And I don't think we could have found a better partner to deliver on that concept of healthy communities.